Hello. So I just swabbed my first patient for potential COVID. Very exciting. Lots of personal protective equipment, which you can see in my embarrassing story. Not really embarrassing. That's just who I am. But you got to have a little bit of a chuckle. Plus, I'm actually also checking that the equipment doesn't tear when I move around. So if you can strut with personal protective equipment on, you should be fine. So let's start with the questions. The first question, where is COVID-18, 1 through 18? Here's how the name came about. COVID-19 is coronavirus disease. The 19 refers to the year in which the virus was identified, which was December 31st, 2019. So that's why it's COVID-19. There's actually probably way more than 19 coronaviruses out there, many of them just causing minor disease. So that's the first question. And what are the symptoms? The symptoms are fever, cough, and shortness of breath. Those are the primary symptoms. There's obviously a lot of crossover with flu, allergies, colds, but predominantly fever and a cough in these patients, and respiratory distress, obviously, in the ones that are having a bad time of the illness. How is it most likely to be spread? It is spread by respiratory droplets. So the easiest way to get it is by spending a lot of time with somebody who has it and who is coughing. So you want to stay at least 6 feet away from people. I've seen other numbers like 3 feet, but 6 feet is what's on the NYC Health website, which is what this social distancing is about, which is preventing you from getting near people who might transmit it to you and thus to hopefully break the chain of infection. And obviously, you also get the virus if you touch a surface where the virus is, which my understanding can sometimes live for 3 days on surfaces, and then touch your mouth. That's why we're always saying, wash your hands, wash your hands, wash your hands, wash your hands, especially before you eat, so that you don't take the virus which is sitting on surfaces and place it into your mouth. Another question was whether you can be reinfected with COVID-19. The jury's actually sort of out on that. They don't really know. There's been some anecdotal reports that some people have been reinfected in Asia after recovering, came down with the disease again, but we really can't answer that question yet, which is telling. So we're going to have a lot more information in a couple of months about what this novel virus does and whether or not you can catch it twice. Okay, so who's most at risk? It really seems to be age dependent. So the curve starts to move up above the age of 60 with the highest risk for mortality being above 80. Also, people who have chronic conditions, lung conditions, heart disease, immunosuppressed, diabetes, cancer. These are all people who, if they were to catch coronavirus, might be one of the people who have a very bad outcome. It goes without saying that most of us would actually have a very mild outcome from this disease, but we're trying to do two things. We're trying to prevent the disease getting to the person who's going to have a really bad outcome. And also, and you've heard a lot about this, sort of flattening the curve. Here's the real issue we're facing. It's not that the individual is at risk. Most of us are going to do fine. It's that as the disease spreads, the number of people who may be severely ill at any one time and in need of ICU beds can become too large for our system to handle. Some of the mortality differences that we're seeing internationally, I saw an article that said there's 10 times the risk of mortality in countries which had overwhelmed health systems, example given, Italy, and countries that had systems which were ready to absorb it, or at least were able to modify their systems to take care of people in mass numbers. South Korea and China had much lower fatalities than you're seeing in Italy. What does that tell us? That tells us what we have to do is prevent the health system from getting overwhelmed. If we do that, the mortality rate for this disease will approach a very bad flu. But if we don't do that, if the number of cases increases too fast, then we're going to have capacity issues, which can have really mortal consequences. So, social distancing. What are we doing? We're staying home. The city has closed venues above 500 seats. Venues with less than 500 have been asked to cut their occupancy rates by half. Restaurants are closing. What we're trying to do is slow the spread. It's going to spread. It's part of life on this planet is this coronavirus. But if we can slow down the spread, then the people who become severely ill will be able to be slowly absorbed into the health system, get taken care of appropriately, and have good outcomes. So you really are doing a public good when you decide to socially distance yourself. Okay, we're all on social media. Use that for now. This isn't going to be forever. And thank you for thinking about others. So when should I consult with my doctor? According to the guidelines on the NYC Health website, you should consult your doctor if you have fever, cough, shortness of breath, or other cold or flu-like symptoms and do not feel better after 24 or 48 hours. Call your doctor. Don't go into the office. You'll risk exposing others at the office, and your doctor can talk to you on the phone and probably send in medication if you need it, or talk about how testing can be accomplished safely. Now, if you have mild symptoms and any of the predisposing conditions like diabetes, lung disease, cancer, immunosuppression, heart disease, you may want to speak to your doctor earlier if you start feeling these symptoms. They can help you decide what you need to do in terms of following up. Most importantly, you should stay at home and avoid other people if you are feeling sick. And then remember, call your doctor in 24 to 48 hours if you haven't been feeling better. Stay home for at least 3 days after the symptoms and fever have resolved. So you want to be if you get a fever and then you're self-isolating, you want to stay at home until you are fever-free for 72 hours, 3 days, while you are taking no Tylenol, no medicines to reduce your fever, right? So we want to have no fever, no medicine for fever for 3 days after you've had a febrile period. Okay, and that will tell you that it's safe to go back outside and mingle. But then again, you shouldn't be doing that because you're socially distancing anyway, but you can go back from isolating to distancing. Okay, it's been a long day. It's Saturday. I'm going home. I'm sure you've got other questions. Make sure to leave them below or send me a DM or a message through Facebook, and I'll either answer them directly or I will add them to another video. But thank you so much for your patience, and be safe out there. Wash your hands, especially before you eat. Bye.